Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Semen analysis is the examination of not just the sperms in the semen, but also the semen quality. We look at the volume, we look at the pH, we look at the abstinence that was maintained before giving the sample. All these factors point us to the quality of the reproductive tract, the functioning and the chance and the diagnosis of infertility. If the sperm sample is good, the chance of pregnancy will be good, at least when it comes to the male part. The female is examined separately. Now, there are some terms that are used to issue a semen analysis report. These are very different from the regular ones. I'm going to talk about the regular ones, but let me also describe the ones that are very rare but are often confused or not understood. So the regular ones are oligozoospermia, which means the count is less. There is asthenozoospermia, where the motility is less. There's teratozoospermia, where the morphology is low. Now let's split them up. We'll talk about count, we'll talk about motility, we'll talk about morphology. In these three things, we'll look at the tough captions, tough reporting terms that are used. In count, we'll talk about cryptozoospermia. Now oligo is less anyway, or severe oligo is also reported. But what is crypto? Crypto is when there are very few sperms. By few I mean just one or two, sometimes a few tens or hundreds in the entire sample, which become very difficult to select on their own, and therefore natural pregnancy or IUI pregnancy becomes a distant dream. So in such a case, what is done is that the sample is entirely searched for whatever number of sperms are there, and intracytoplasmic sperm injection is performed where embryos can be created and pregnancy can be achieved. This is a reporting that has to be very carefully performed, because it also involves looking for sperms very carefully and not calling the sample as azoospermia, as in no sperms are present. It's imperative that the andrology technician look at the sample very carefully. Next, coming to motility. In motility, the common terminology used is asthenozoospermia. It also can be severe asthenozoospermia. It means that the number of sperms that are moving are very few. Now, inside asthenozoospermia or inside motility, there are three subdivisions: progressive, non-progressive and immotile. Progressive means they are moving very well, they are moving forward, sideways, whichever way, but this motility is good. The sperms are able to move. Non-progressive means that they are not able to move definitely, but you can see that they are alive, they are twitching. They are at that same position, but you can make out they are alive. The third is immotile, where you don't know if they are dead or alive, but they are definitely not moving. You cannot yet say that they are dead or alive. There are various tests that are performed to see if the sperm is dead or alive. If the sperm is dead, it's of no use, but if it is alive, it can be certainly used, and embryos can be made, and chance of success can be definitely looked forward to. Now, this is motility. When we talk about motility and we are talking about immotile sperms, let me bring another term to your attention. It is called as necrozoospermia. Necrozoospermia should not be confused with asthenozoospermia. Asthenozoospermia is where sperms are alive, they are not moving. They could be dead or alive, we still don't know. Now, necrozoospermia is where the number of sperms that are alive are lower than the number of sperms that are immotile. So we do something called as a vitality test, where the sperms that are alive can be identified, and it's a percentage. If we look at that and we find the vitality to be lower than the ones that are immotile, then definitely the sample is usable. If it is totally not viable, if the sperms are not alive at all, they cannot be used even for intracytoplasmic sperm injection. This test is very important, especially when the entire sample is with immotile sperms. We look at the ones which are alive and then assume that we can definitely use it for ICSI, where embryos are produced. So this is about motility. When we talk about morphology, we talk about teratozoospermia definitely, where the sperm is defined as something that has a defect. It could be a head defect, tail defect, mid-piece defect. All these defects can be severe or low, but if they have defects, the defects also are described. Was it a head defect, mid-piece defect or tail defect? Every sperm is not analyzed, it's a percentage. So how many sperms are defective and what are the major defects that are observed? Inside of this, there is another term that is used which is very rare, but it is a morphological defect. It is called as globozoospermia. Now a sperm has a head, mid-piece, tail, as we are aware. The head has a cap-like structure which is called as acrosome. This acrosome is critical for fertilization. Once the sperm reaches the egg, the outer shell of the egg and that cap of the sperm interact with each other, the sperm is able to go inside the egg and fertilize it. So you can understand that without the cap, this activity will not happen. When the cap or acrosome is absent, then such sperms are called as globozoospermia sperms. It's a very important factor to identify and report, because such sperms will not be able to fertilize eggs, and no matter how many months or years you try, pregnancy will be evasive. So it's very important for andrology technicians and embryologists to identify such a sample and report. Now, what are the treatment options? Definitely, identification is a huge challenge, but once identified, there is a treatment option under intracytoplasmic sperm injection. These samples are exposed to a certain special solution where the sperms are activated, because without the cap, the activation is not there. Activation as in moving to the next step of fertilization. This next step can be enhanced by addition of special solution, whereby the sperms can then be injected into the eggs to produce embryos. So there is a solution to all the problems that I talked about, but it depends on to what degree has the defect affected the sperm. If you want to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.